Hello and welcome to Something Positive for Positive People. I'm Courtney Brang. Something Positive for Positive People is a 501c3 nonprofit organization that educates people on minimizing stigma. Primarily, we educate healthcare professionals, people who are in the mental health field, about taking a stigma-free sexual history in a way that can minimize the negative psychological impacts and emotional impacts of a person who has herpes. In addition to that, for those who are positive for herpes, as y'all might know being here, we interview people who are navigating herpes stigma, not just people who have it, the partners of people who have it, people who work with people who have herpes, like our guest today here, Dr. Naz, who I'll let introduce herself after a couple announcements real quick. So Something Positive for Positive People is currently going through a little bit of a shift. So, over the last 7 years, since 2017, we've mostly been interviewing people living with herpes about their experiences from diagnosis to disclosure, about their sex life, about their relationships, about navigating the medical field as well. And we're going to keep doing that. So we're going to continue to do that. But there have been a lot of things that I've made an effort to just kind of lump into the organization in an effort to get more community engagement in order to raise more money. The yoga, the support calls, the support groups. Yeah, we had a Fet Life page. I made a Fet Life page just to bring people there who might, be kinky living with herpes and want that level of support. All of that made me kind of take away from the podcast. And that's why I went on a little bit of a hiatus for a while from interviewing people because I didn't want to burn bridges. I was doing a lot of those things, including applying for funding, which fortunately we were able to get. There's two things. We got a $10,000 grant in order to do a pilot of this simulation experience where I'll bring sex educators to serve as patient actors to work with medical professionals and give them the practice of taking the history around their peers so that we can utilize that feedback in a way that is the educational tool for them to practice. I want to say queer friendly, stigma minimizing, sexual health history taking. And then we just got a $7,500 grant from Advocates for Youth. I hope that's the name of it. If that's not, I'm gonna feel so bad. But yeah, we just got that email. I'm waiting to hear from the board. We're supposed to go to a dinner ceremony or a lunch ceremony or something like that. So I'm excited about that. And I believe that that one is to do a little bit of research. So part of that will be included with the podcast interviews. All right. So boom, we're almost at we're at 3 minutes of me making announcements. So last thing I want to just also mention that I talked about, trimming the organization and making sure that it's like more concise and communicative. We're going through someone to get some branding done so that things can be more consistent and concise. So, when you go to the social media pages, when you come to the website, this is what you get. You're going to be here for herpes support resources, or you're here for the sexual health training simulation. So I wanted to just be those two things. You can listen to the podcast. We'll be providing the data and using that to guide our trainings. And yeah, I think that's really going to be it. I don't, I want to get rid of the support calls, but there will be another avenue to access that. And with that said, if you've been around for a while, you heard of Selfed, and Selfed was just sort of like my passion project. I was talking about emotions and those experiences, and now that's going to be another nonprofit in itself. So you can follow that Instagram page at Get Self, but this is going to be men's emotional wellness resources. That's it. So a lot of the things that I was trying to force into something positive that didn't fit are going to now go there. But we are going to continue to run the podcast. We're going to do those simulations, continue with our research, data collection, and advocacy. And yeah, those are all of the announcements. On June 30th, we have the Emotional Wellness Symposium. I've got 4 presenters I'll be facilitating conversations with about emotional intelligence, emotional immaturity, emotional ignorance, and emotional avoidance. And man, anyone is welcome to attend, but we're only going to be prioritizing the interactions between the men who are present. presence. So you can go to the events tab on spfpp.org in order to register for that. That is everything. So now that I just made you sit through a 5 minute introduction of things that mostly don't have much to do with you, I want to have you go ahead and introduce yourself. Here's our guest, Dr. Nas. Dr. Nas, can you just provide us with a brief intro, title, description of who you are and what your work is?
First of all, Courtney, congratulations and all of these wonderful success. I know that you work so hard for these things, and it's a wonderful resource that you're providing the community. So, it was my pleasure to hear all of the kind of positive things that you're doing in the world. I'm Nazanin Moali. I'm a clinical psychologist. I have a PhD in clinical psychology, and I'm ASAC certified sex therapist. After getting my doctoral degree, I went to get additional training in sex therapy. I have a private practice in LA. Also, I have a podcast as well that's called Sexology that I've been airing weekly episode. It's on kind of talking with other people, other researchers, and also expert talking about sex and pleasure and kind of helping people with getting the sex education that's sex positive and they haven't received. You know that wasn't the case at least for me. So I'm trying to fill the gap in that area.
Yeah, well, thank you for being on the show. You had me on your podcast as well, which is a fun conversation. I always like, I love being interviewed. And so it's nice to also be able to return the favor by just having a conversation that I think would be helpful to our community, our listeners, which, as you know, is mostly people who are living with herpes. And in your work as a clinical psychologist, right? I said that right? Because
Yes, yes, you said it
butcher.
perfectly.
All right, I butchered titles so badly. Um, you've worked with people. You do work with people who are living with herpes, and I would like to hear from you. Just what are some of the general reasons that a person might seek you out? And are these people who tell you right away that they have herpes? Are they seeking you out because they have herpes, or is it something that comes up later?
Great question. So, whenever I see a client, I always do sexual health history, even if they're coming for depression, anxiety, because that's so important to check in with people and give them the space to talk about the questions that they have and also share that part of themselves. So, sometimes it comes that way that people talk about, like, I'm STI positive, and we talk about is that something that they want to kind of process in session or not. Sometimes it's not their main concern, so that's just an information we have. I have several clients that they sought me because they got a diagnosis and it was hard for them. Dating piece was very hard, and they were feeling that they were defective. They were feeling that I'm broken, I would not be finding a person. So all of those negative emotion that comes up. And I also have a good number of people that are dating, and I hear the other side of the story that someone disclosed to them that, like, I'm positive for herpes, and as they're navigating this and kind of like processing it in therapy to make the decision if the relationship is a fit or not, I hear that part of it as well.
Okay. And what are some of the other things that people are there for if they don't want to process their herpes diagnosis? If you can talk about that.
Yeah, of course. So there are lots of people coming issues in the relationship, like desire discrepancy, erectile dysfunction, erectile issues, orgasm issues. And in addition to that, sometimes people have depression and anxiety. It has nothing to do with their SDI kind of diagnosis. It's more about the state of life. And something that at times I hear from my own client is that sometimes when people, as soon as they hear SDI, they make the assumption that's why people are there and kind of thinking about that's what we're focusing on. But sometimes it's just like part of people's experience and history, and that there's no need for us to focus on that.
Yeah. Thank you for sharing that because I often speak to this statement that I make: sexual health is mental health. And I see that people's sexuality sort of becomes their identity to the point where when they receive a positive diagnosis, that it not only changes this sexual piece of themselves, it changes their whole view of themselves entirely. And so, what I'm hearing when you talk about people who they may not want to do any work around their diagnosis because there's other things going on, that tells me that there are people out there who might have herpes that are prioritizing other things to work on to heal that may not necessarily be related to their diagnosis. And so, out of curiosity, I would like to know if you would say that someone might be avoiding dealing with their diagnosis and prioritizing these other things, or if their herpes diagnosis itself is just not that big of a deal compared to these other things.
Great point. What I see that at times for people that they haven't dealt with the shame and guilt, which is totally understandable, related to kind of like experiences they had with SDIs, and then they avoid talking about it. It's very challenging for them to talk about it. Also, the other piece is that they're trying to justify, kind of like having these kind of like justifying themselves versus people who have done work around it. They're at the other part of the journey. There's nothing wrong with the first group of people, right? They're at the different part of their journey. But the people who are kind of done the work, when you do the history, they're comfortable. They're sharing this, like, this is my diagnosis. This is what I've done for it. And that's it. It's comfortable for them to talk about it. But that's like getting a history is much quicker and easier for them. And they, when I check in with them, is that something you want to focus on? It's comfortable for them. They're saying like, no, I have this feeling about it, and this is not what I want to prioritize as treatment, and that's completely okay.
Okay, yeah. Um, You mentioned some people dating, and then that there are people who don't have herpes who will talk to you, about someone maybe having disclosed to them. I have two questions, but one at a time. If I forget the other one, it'll be fine. The people who come to you or they're clients of yours and they're dating and they engage with someone who has an STI, how do they bring that to you? Like, how do they start that conversation with you?
Well, it's kind of easy because I have a strong rapport with my clients. So they tell me everything and about their sex life, everything about their intimacy. So whenever they get an information, they're comfortable talking about it. And oftentimes, I hear people are at the place of curiosity with it. Like when they hear the disclosure in a way that I know you're talking about it, they're kind of curious about, okay, what does that entail? What does that mean for me if we have more sexual connection? So those are the things people are curious about.
That's good because I always say like the best way to receive someone's disclosure is just with gratitude and curiosity, right? The best response you can get is thank you for telling me, tell me more, right? Like what does that mean for us? How does that affect you, right? I think that that kind of response, if the general population, whether they don't have it or don't know what their status is, if people respond that way, I think that we will see a lot less stigma. So it's great that you are at least working with clients who receive it in that way. My other question to you was, do you notice a difference in how people talk about herpes between if they're in a relationship and if they're single, if they are positive themselves?
My experience is that when people are single and dating, they have more questions about it. They're more in the gathering kind of part of the information, and that's different. But usually, when people are in relationship, they have the majority of information, unless it was infidelity, right? So that's like there are often things that there are other layers to it. Like I have clients that they haven't disclosed to their partner, and then after having sex disclose it. So there's a feeling of betrayal there versus kind of like people go outside the relationship and the betrayal is there. So it's not about necessarily the diagnosis at times. It's more about kind of like how people learn about it and the trust that's getting broken.
Can we talk a little bit about that? Like telling a person after, so they have sex with someone and then they tell them. Uh, I would like to know. what does that conversation look like in a clinical setting? Because I talk to people often who may not have disclosed for various reasons, right? And just across the board, if someone, was assaulted, the sex wasn't wanted. If someone may have had too much to drink, maybe they didn't know how to tell the partner, maybe even the partner didn't ask. And this is one of the things that we cover with statistics in the Something Positive for Positive People conference that we had earlier this year. That's up on the website. You can check that out on the conferences tab and get access to that. But I want to know, like, how does this conversation get started with you?
Well, I believe that majority of people are good people, right? Like the reason that they're not sharing it is because they don't have the tools on how to communicate it, or the shame is very strong. So the intention often is not like I'm gonna hide it from the person, right? That like they're not gonna know about this. It's more about how can I bring it up. So usually what happens is that people uh, kind of say that okay, after like things escalate and we have sex and we haven't had that conversation before, and the day after, like I have this conversation, or a few weeks after I have that conversation, and it's barely a year that goes well, right? Because the person feels like they've been kind of betrayed, tricked into the situation, which again, if people have the time to process it, that's not usually the experience that I hear from my clients, right? They think about, I made a decision, I made the informed decision. Because like all form of sexual experiences, if it's partnered, has some kind of risk, and we're constantly making risk assessment. And it's one of those things, right? That like, okay, where am I with my level of being open to have this experience? So that's what I often hear.
Okay. And when we talk about those tools, right? Where would you say that some of those tools should be available, right? Because we're in this time where sex education, and there's a lot of just disagreements about when youth should be taught or talked to about sex. And then there are many adults who are having sort of these kind of conversations for the first time, either after they get a diagnosis or when someone shares their status with them. So where's a good, appropriate, I don't like that word here. I want to say a fitting time or place for us to incorporate these tools and tell people, hey, here's how we talk about sexual health. And then we can also expand on that a little bit and also talk about pleasure because that's what a lot of your work is in as well.
Well, you first of all brought up such a great point. Like sex education needs to be comprehensive, and pleasure is part of that education. Like what we hear, I think that's which is part of the issue. When people learn about sex, we kind of like use STI to scare people off, right? So that's the information they get about STI. It's like horrible images of the worst case situations, and people, in order to like, their hope is to kind of like discourage people to have sex. That just never works, like any culture, right? Just people don't have the tools to kind of think about what to do with it. My invitation would be to kind of, first of all, when you're talking about kind of like sex education, when you're thinking someone will have start having partner sex, couple years before, when you're talking about STIs, talk about the conversation about that. Because the other thing we're hearing is that, oh, checking with people about their STI status. But it's not an easy conversation. I know many people don't know how to have it. So what kind of a tool is that, right? We need to teach people, how are we going to do that? And also, how are you going to disclose if that is the situation? And it shouldn't necessarily be one and done, right? So that would be the first point of information. Second, I would say if people are in kind of a higher kind of education when they go to college, that's also something else that we can kind of expand on that conversation. Also, when people get the diagnosis, I think uh, providers, we need to be more educated about this. Also, helping people with how can I connect you with resources like your podcast, right? Maybe right now you're kind of processing it, but now like this is a resource. I think about it as so you can learn more about it. Because sometimes my experience is that people are just so devastated, they're kind of processing the grief, that just they don't want to receive the information on that moment. But if they have the resources, they can go and see, okay, how can I have that conversation? So I would say it needs to be a multiple conversations.
Yeah, I agree. So what I'm hearing in that is that there need to be it can be chunked. So we have this whole how to talk about sexual health, how to talk about pleasure as well. There needs to be phases. So one of the conversations that we had at the conference was on stigma minimization in youth sexuality education. And part of what our speaker Dakota Rampin was sharing was that there's a conversation that can be had with all ages around boundaries, around the language with their bodies, being able to communicate things that they do and don't like. And this is completely, platonic. This is them talking to their peers, their family, not meditators, um, their teachers, educators is the word that I was looking for. And as we progress in age, what we provide youth as the core structure of communicating boundaries and what they need to feel safe, and talking about their health, period. This levels up when it becomes time for them to start engaging in the relationships that they have over time. And as we have that foundation, we can just add another layer onto it, another layer onto it, another layer onto it. And then perhaps, in college even, that can be where we begin to learn, more of the things that people are bumping heads about their youth learning, because now at this point, these are young adults and they are more likely to engage in sexual activities in ways that can cause more harm. So being able to layer more and more of the necessary education, that's something that I also agree with. And also when we're talking to our health professionals, when we go get any screenings done, or when we're talking about health, like being able to comfortably talk about sex is something that all medical professionals should be able to do, which is why we're offering these simulations. So if y'all uncomfortable talking about sex and sexual health with y'all's clients or your patients, like hit your boy up. But all that to say, yes, I agree. Thank you. I wanted to say just one more thing about herpes, unless you give me something else to like piggyback off of. But I noticed that as we're talking about your clients, the people that you work with, it's so much of how to communicate about it, and there doesn't seem to be much about the physical symptoms. And please correct me if I'm wrong, but would you say that any of your clients are coming in and complaining really about the symptoms or how it expresses or pain with this virus?
No, I don't. I'm a psychologist, so maybe that's part of the reason that they're not talking about it. But it's such a great point that you're bringing it up. I haven't had clients saying that the physical issue related to SDI was something that I kind of like really impacted my quality of life in a physiological level, right? So I hear more about the psychological shame with it, relational ramification, and uh, how to navigate your health as someone that you're dating someone with a herpes diagnosis. So that's also something that I feel like lots of people need support around.
Yeah. Okay. Well, thank you. I wanted to like highlight that because that seems like something that's really important and part of, why this conversation is being had and why this organization exists is because that's the real issue, that people don't have safe places to be able to bring that up or talk about like how challenging these aspects are, especially if other people can't relate, or if we're not at a place right now where people can have that kind of conversation or start talking about that without being judged for, you know, just having the herpes virus. And there's so little accurate and trustworthy information that exists out there. And, I've been talking to people for 7 years, since 2017, who are living with herpes. And I know, like, I can tell right away, like, oh, this is BS, right? Like, I know a dozen people who their experiences are completely different than what this piece of information that has credible backing says. I look at some of the data and statistics that exist out there, and a lot of it doesn't really reflect the experiences of people who are living with herpes. So I appreciate that you yourself are another one of those spaces where clients can comfortably and confidently communicate with you about what they're struggling with. So, as we look at the kind of support that you offer to your clients as a clinical psychologist, what can someone who has herpes expect if they come to you and, that's what they want to talk about? Like, how do you meet them? Like, what are some questions that you ask? Like, just share whatever you can about, speaking to a clinical psychologist, you specifically, about your diagnosis.
Well, you brought up such a great point, and I think part of the challenge is for healthcare providers not having the information. And I'm glad that you're doing that kind of training because what I know about my education, I have two masters and a PhD. It wasn't until I got more additional training on sexual health. I didn't know what to expect, how to have this conversation. So I think the first thing is like we need to provide the information to the providers. But as far as how the kind of like conversation goes, usually people kind of put it on the intake, right? When you're going to a psychologist, all the information you're sharing with that psychologist is confidential. If they kind of share any of that information with anyone, they need your signature. So if it leaks, you're gonna be rich because you can sue that person. So you can put it on the intake as much or as little that you want to know. Okay? Like you can just put it like, I have STI diagnosis that I want to kind of process, or you can put paragraphs and paragraphs, right? So kind of like talking about the history and usually kind of having a goal for yourself is really helpful. So maybe I want to overcome the shame. Maybe I want to be confident in dating. I want to kind of like learn more about my own erotic interest. I love that you're doing the work on fet life, right? Like maybe I'm kinky and see like how would that be kind of fit in with my whole sexual health. So I would say like put that on the intake so the provider knows. Some people you can do a phone call. Again, SDI, I think like any other health condition is something that if you're comfortable, you can share that I'm coming in the same way that someone said, like, I'm coming in because I lost my partner. I'm coming in, this is my presenting issue. I don't think there's anything kind of like different about it. I know it's shame connected to it, but as far as the provider's work, there's nothing different about it. It's a concern that people have. And we're kind of, when they are in this session, I usually do a check-in with people about who are you, what do you want to get out of the sessions, and based on that information we can go deeper on what part of this you want to kind of explore. What is it important? So is it related to what you're coming in, or it's just an information that you want me to have? And at times you can say like, this is something like condition I have, like STI and I have herpes, and it's just very difficult for me to talk about it. So the provider would know that okay, so this is something that I need to gauge with kindness and intentionality and give people more space. That is really important. One thing that I do with people overall, because talking about sex is just so stigmatized in our society, and we all have majority of people have sex, and no one kind of like educate us about it, and there's just a layer of shame around, especially with the older generation. So I tell people that if I say something, if I something happens that you feel uncomfortable, please let me know. It's not responsibility of client to educate me on these things. It's absolutely responsibility of provider to have all the right information. But I think relationship matters. So kind of like happening, what you're experiencing in the office with a provider that you feel comfortable, in a way mirror how you're experiencing your relationships outside. So that also can be a data point. So the more you can practice with the provider talking about the diagnosis in a shame-free way and attending to emotions, like what shows up for me when I'm talking to my provider. I think that's a very valuable information.
Yeah, thank you. And you actually just spoke beautifully to the transition that I wanted to make. We talk about, herpes stigma, and from what I see, herpes isn't exclusively a sexually transmitted infection, but it's lumped into that regardless of how it transmits, whether it be orally or by hands or physical contact, or if it's somewhere else on the body that isn't isolated to the genital region. And you spoke to like sex being stigmatized. I believe that how we view sex is the reason that we view herpes the way that we do. So it isn't necessarily herpes that's stigmatized, it's actually sex that's stigmatized. Can you elaborate a little bit more? I think you were kind of going in this direction.
Well, you brought up such a great point, right? Like anything around sex, we're just so curious and we're just not open about it and shame connected to it. And that's it comes from not receiving a right pleasure-based sex education. So as far as kind of like the sex, I'll give you an example that's really funny. When I tell people I'm a clinical psychologist, they're like, wow, very impressive. And when I say I have additional training in sex therapy, people take me less seriously. So I don't know how can a certification that requires investment in time and energy can make you less reliable and credible. But that's kind of people's experience around sex. We don't see sexual health as part of human rights, right? That is part of your rights. And kind of like having information about it is really important. So, and lots of people they have shame about their sexuality. Like the way that society portrays sex is very, very narrow. I barely meet someone that their fantasies is what they're supposed to be, or the acts that they're interested in what is supposed to be, right? So our sexuality is different. No one talks about it. So we feel shame about it. I get lots of people telling me, oh, I have this type of fantasies. This is a porn I'm watching. Am I broken? And I was like, no, like that's like research shows that people are like a lot of people are interested in this. So I think it comes from not feeling comfortable talking about sex, not having the right information, and also kind of like coming from our fear about sex, right? So I think societies that are more abstinent based, um, it's just like open up the door for people to have all sort of uh, kind of negative experiences around their all of the sexual experience, right? Because it's shame connected to that. And I can imagine when someone getting an SDI, then that would add to this shame, right? You've done something that was wrong, and therefore, like you have this, like this issue. Instead of thinking sex is a normal part of human life, pleasure is really important for my mental health, and any type of sexual experience I have, there is some risk associated with it. Unless you're masturbating, there's a risk associated with all sorts of sexual experiences.
And I mean, if you masturbate at the wrong time, you got some kind of risk too. Like, let's say you go out, you go to dinner, you eat some spicy food, and then you go home. You're like, you know what? I want to rub one out real quick, and that
Mhm.
obviously happened to somebody. I ain't gonna say who it was, but somebody done that. Uh, so just something as simple as like wash your hands. Like wash your hands.
Mhm.
We practice, hygiene, quality hygiene to the best of your ability. Just wanted to throw that in there. Um, as a metric of or a method of adding to the quality of safety. I don't like using that word when it comes to sex. Um, when we talk about sex, we talk a lot about shame and what that looks like. But I'm curious to know, like, what are the positive sides of sex? Right? You mentioned orgasms. You mentioned pleasure, especially as a sex therapist, being able to speak to this and work with your clients on this. I know so many people who can identify bad sex or what what's painful, or if it's too fast, or if it's if they're having sex with someone with a penis, it's too small or it's too big. Can we elaborate on what pleasure can look like what is good sex even?
And that's just such a great point that you made, Courtney, about like what is good sex? Because what feels good to me might feel completely different or mediocre to someone else. One thing I tell people is really important to know your erotic self, right? Instead of like pushing aside your erotic thoughts and thinking you're dirty. So I think very helpful if you kind of get curious about that. We all had fantasies or have fantasies or sexual experiences that just like are so exciting to us. And like many people, when they want to kind of orgasm or they have like they want to masturbate, that's where they go. So we call those peak experiences. So it's important to kind of journal about it, maybe think about it. What was it about that experience that made it special for me? For sometimes for people it's a connection, for sometimes it's adventure, how I felt. So it's really important to think about what is the meaning of sex for me. So if you know what's the meaning of sex for you, you will be able to create those experiences. It's like you know what genre of a screenplay you want to write, right? So maybe you're into crime stories, and could be the plot could be completely different, but still can be a great crime story. Sex is the same thing. If you're into adventure, okay, so what would adventure feel like to me that would be exciting, what would be slightly risque, how can I communicate that with the partner? So knowing that it's about the connection. I don't need a big penis for connection, right? Like if in a heterosexual relationship, it's more about the communication, what happens before, the level of intimacy, the position you're choosing. So I think at the core of it is knowing your erotic self, erotic
Mhm.
mind. And it's a learning process for most people because our erotic mind shifts and evolves, and there is nothing wrong with that. So, kind of knowing that and being curious about that and having sexual conversation outside the bedroom with partners, even if you're with the partners for years and years. I tell all of my clients that they're coming in, it's really helpful to have sexy happy hours. So, sexy happy hours, you can have mocktails, cocktails, it could be once a week, once a month. You're kind of like have to have this dedicated time to talk about sex. That's a time that you can talk about what feels good for you, your fantasies, if your partner is okay about that, what went well for us last month, what do we want more of, and if there's any issues, we can talk about it then. Because one of the issues that at times I hear is that the only time people talk about sex is when something is going bad, right? So unless something horrible going bad, people are not talking about it. So having these check-ins kind of can make things very sexy, informative, and also create this container for you to have more of a give and receive feedback.
What you just spoke to makes me think about all of the aspects of pleasure that aren't related to sex, right? You mentioned communication, you mentioned talking about sex, and that's part of communication. You mentioned connection, right? I want to know if there's more that we can elaborate on here, because I think a lot of times when people hear sex, they think, penis into vagina or mouth or anus, and there's no elaboration of it. So, like, it's intercourse. People think intercourse when they hear sex, but sex, as you just spoke to, is part of, or these, communication components are part of sex. What other things that we don't normally associate with pleasure or sex that have nothing to do with intercourse can we begin to get curious about?
Well, when we're thinking about sexual experiences, there's a psychological component and physiological component. And psychological component could have nothing to do with what's happening in that moment, right, with the partner, like the anticipation, the fantasy, the energy exchange between the people. So that is part of what to kind of make that spark exciting. And I think oftentimes the physiological component, as you talked about, people think about, oh, the only way I feel pleasure in my body is this like one way. And my invitation to everyone is to kind of explore different types of pleasure and different way of receiving pleasure in your body because we have so many erogenous zones that many people do not know. And maybe pleasure mapping with your partner, kind of getting curious about where do I feel pleasure in my body, kind of can be very, very helpful. So I think that's also something people to keep in mind. But I think also psychological component is so, so important. Novelty is something that is missing in so many long-term relationships. And novelty means, like, again, if you've been having the same type of sexual experiences, the chances are you want to explore something else. It could be something else, kind of a changing psychological component or changing physiological component. And receiving pleasure, it's a skill that we need to practice, because we talk about pleasure is like something is negative. Like people say, oh, I had this kind of guilty pleasure when I have chocolate. Pleasure is good for us. Pleasure is a source of happiness. And as human beings, we're not machine. We need pleasure. So I think it's important to keep that in mind as well. So you will be able to allowing yourself to receive pleasure.
And hearing you speak about the word pleasure, I think that a lot of times it is associated with sexual acts or sexual activities or food. Are there other examples that you can give us for what it's like to experience pleasure aside from, eating that chocolate or having a pleasant sexual experience? Like, what are some other ways that people can begin to start reconnecting their brains to identify pleasurable experiences, interactions that don't necessarily involve the genitals or the tongue?
Well, having gaining experiencing a sense of mastery can be very pleasurable, like a skill that you were kind of working on learning. And when you learn it, that can be pleasurable. Our human connections are extremely a source that's neglected when it comes to a source of pleasure. I know one of my mentors says addiction is the disease of disconnection, right? So when we have pleasurable conversation, connecting experience with people, that's also enriches our lives. And I would say that those are also equally important than sexual pleasure. Even I have clients that talk about my partner getting what they want in life, getting something they want in at their work. That can give me pleasure. So as you mentioned, sexual pleasure is, there's nothing wrong with that, but it's a one part of so many different layers of kind of pleasures in life.
Yeah, thank you. Thank you for being able to elaborate on that. So I want to touch a little bit more on the sex therapist component. I have a general idea of a sex therapist, what their work is. We've interviewed sex therapists in the past. I'm curious to know from your perspective, like, why should a person or why would a person seek a sex therapist over a clinical psychologist? And is there any benefit to our listeners who might be, someone who has herpes and maybe they're struggling with stigma, maybe dating, maybe they have other things going on? Why should, what are some of the benefits of potentially reaching out to someone with your background?
Well, sex therapists, they often get additional training on sexual health. So many of the information that's not available, kind of unfortunately missing in our event sex ed, that's something that you learn during training. One of the part of many parts of what you learn in your training as sex therapy therapist. What I hear from many of my colleagues that they're just like generalist psychologists, they are very well equipped to help people, but there's a gap of information unless they seek out specifically kind of sexual health kind of information in their information. So I tell people that I kind of think about, first of all, the connection is really, really important. So when you want to choose a psychologist, sex therapist, it's really important someone that you feel comfortable enough, because the kind of big part of therapy is being vulnerable. So I would say the connection is really important. So if you find a psychologist and you feel they're educated about health and you're comfortable talking to them, maybe they are a better fit. But overall, if the kind of like the dating, sexual health, sexual function is something that you need training and support and processing, uh, sex therapists are perfect people for that. For that, because they have tons of experience working with similar people, they have access to resources if it's important, and they have the toolbox of being able to hold space for you to do the work of therapy. Sometimes, for example, maybe we have an eating disorder. Like eating disorder is something I see also in my practice, and like that's the main focus. And the secondary piece is the STI kind of issue. Then I would say like go with the specialist but having in mind that they might not have the information. Hopefully, in the perfect world, you want to get someone that has a psychologist with sex therapy background so they can help you with navigating health, overall health things, and also sexual health.
Okay, thank you for that. I ask because I think that I see that there's a consistent misconception of sex therapists like, oh, you're going to help me with sex. And there's so much more to it than that. And I also think that people don't consider utilizing or reaching out to a sex therapist just because they think that they don't have problems with sex. So there doesn't necessarily need to be anything wrong before a person reaches out to you. And that's kind of one of the things that I wanted to just be sure to emphasize here as well. With people, if they're not even having sex, but maybe there's something there, or if they have a great sex life, they can still reach out to and connect with a sex therapist, right?
Absolutely. You mentioned something really good. I always compare it to physical health, right? Like you can go to get a trainer because you have a good body and you want to have a great body. You can get a trainer when you're not absolutely don't know anything about her health, or maybe because you have an injury. Sex therapy is the same as well. Actually, if you're waiting for years and years after having an issue, then coming to sex therapy, then the chance of success will be, especially in relationship, less because now we have layers and layers of issues compiled together. But sometimes when you have and you see like in just few weeks or something that's not going the way I want it, maybe I can consult with someone. Again, going back to the health part of things, maybe I can kind of do it one session with this person to see what are some of the things I can do better, or what I have this particular question, so I can ask that question. So you're absolutely right. Sex therapy is actually better when people kind of like seek it because they're not in crisis. Because when we are in crisis, still can work, but it might take longer to kind of like help us to get to the strength part of the experience versus kind of like addressing the crisis.
Yeah, thank you. Thank you so much for just your expansion on some of these topics. And of course, the beginning part where we talked about your work with clients who are positive for HSV, the ways that you support them, talk to them, and some of the challenges that they have, as well as their ways of going about addressing those challenges. And we even talked a little bit about sex stigma and some other ways for us to view pleasure. Is there anything else that you would like to cover before we start to close out here?
Only thing I want to people to kind of, there's one thing I want you to take out of this, like you deserve to have pleasure in your life. It's important to prioritize pleasure, whether you have the diagnosis or not. In life, unless it's a dollar prioritizing our pleasures, we're not gonna meet our potential for it. So that's something I want people to keep in mind.
Yeah. And when you say we're not going to meet our potential for it, right? Like there's no cap on pleasure, right? Like we don't get to pleasure and then that's it. Like this is it. Is this something to always be pursued? Is this something that's, that's all around us? Like how can we encourage people to experience pleasure without making it seem like it's just, oh, so much work or it's so unattainable?
Well, I think it's doing the self-assessment, right? Like, what are some of the area of life that I'm doing well, and what do I want more of? But I'm in my deathbed, right? Like when I'm about to kind of like leave this world, what kind of experiences I want to have? Like majority of people, they don't say I want to have more money when I'm dying, but many people say I wish I had those pleasurable experiences. I wish I lean into pleasure because pleasure is all around us, and sometimes it's just so disconnected with world. We're just so in our head that we don't notice it. Even practicing a mindfulness can help us to kind of like pay attention to all sorts of pleasure around us. And I would say like start small. I'm thinking about, okay, this week what can I do to do 10% better with experiencing more pleasure? So that can help us to kind of identify some of the small adjustment I need to make at minimum. Hopefully that you're prioritizing pleasure and you're identifying the sources. and you're checking about it with yourself. But if that's something that you haven't prioritized, kind of focusing on small steps, 10% more, what would that look like? And also kind of like experimenting. What are some of the new ways I can experience pleasure this week, whether it's through food, relationship, reading, all sorts of things.
Okay. So you heard it from Dr. Nas. Pleasure is a priority. So this is your prescription. We are prescribing for you to practice prioritizing pleasure. What a lot of P's, all the P's right there. All right. Well, I guess we got our podcast title out of that too. So awesome. Thank you, Dr. Nas. How can people connect with you? Where can people go to listen to your podcast?
Well, wherever they listen to this podcast, they can look up Sexology. Sexology podcast is like that has my face on it, and it's like something that I've been doing for many years. And you can go to sexologypodcast.com if you want to listen at the website, and you can find my all of my information there. And in all social media, I'm at Sexology Podcast. I would love to hear from you. Like I read every single DM, so if that's something people are interested in, they can connect me there as well.
All right, thank you so much. How lucky do you have to be to get sexologypodcast.com? Like you got that name, and there's so many sex and sexology podcasts, but you've got the Sexology podcast. So good for you. Good for you. All right. Well, if you could stay on for a little bit just so we can kind of debrief afterwards, I'll go ahead and close this out. That concludes this episode of Something Positive for Positive People. Please like, rate, review, subscribe to, share this podcast. You can visit spfpp.org/offerings to see upcoming events that you can register for. We've got the July 17th. We're hosting a herpes disclosure workshop. This is free for members. You can attend virtually, but we're going to also be live in New York City at Hit Me Up Space. This is on July 17th. I think we're going to start at 7 p.m. And if you can't make it, we'll record it. You'll be able to just register now, and then you can watch it later. I don't know if y'all have picked up on this or not, but if you don't come to a thing and you're like, oh, well, I wish I would have used that when I needed it, it is going to cost more for you to get it later. So get the ticket now, register, and have access to it. Or you can just become a member and get access to all of the virtual events that Something Positive for Positive People hosts. We also have September 29th. It's going to be the Safe Sex Expo here in New York City. That too is going to be a Hit Me Up Space. We're reaching out to vendors now. We've got 4 speakers lined up. And what we're doing is exploring the spectrum of safety and pleasure. We'll have someone offering like a class on spanking as well as dirty talk. And then we'll have Dr. Evelyn Decker, who created the Stars Talk, who by then, I don't know if the book will be released, but the MakeTimeForTheTalk.com, I've had her on here, episode 299, talking about disclosure. We're going to be talking about and actually providing demos and giving people practice with talking about their desires, their sexual health, their boundaries, right? It's going to be a really good time. And then when this is up, we've got June 30th, the Men's Emotional Wellness Symposium is going to be up. And I'm currently working on the self.org website. I think it's going to be getself.org because self.org was taken for whatever reason. I don't even know who would use that. But this is going to be emotional wellness resources for men as a nonprofit. So we'll be doing more in that arena. That doesn't take away anything from Something Positive. It's literally just having trimmed a little bit of excess organization stuff and placing it into a more appropriate space. So I appreciate y'all for being with me as I tried to navigate that, but now you know what to expect. You got this podcast, trainings for healthcare professionals, as well as the research and education that we use, taking the lived experiences of people navigating herpes stigma, as well as professionals like Dr. Nas, and bringing that perspective into STI or sexual health, sexuality education, and integrating that into STI prevention efforts. All right, that's it. You can get in touch with me on Instagram. You'll notice that we changed our handle. You can search Something Positive for Positive People on Instagram. And then the name now is Stigma Minimization for our Instagram. And like I said, we're going through rebranding, and you'll see much more consistency across the board with what we post, what we share, and all of the content moving forward. And you can follow my men's emotional wellness resources page at Get Self. Thank you.